Health is the most important possession of we mankind, but yet the most neglected. Well, the fact is that the wealth of a human is its health. How true? Today we are going to take you into a program called Meet the Masters, and we will draw your falcon's eye view into the stalwarts of the healthcare industry. And I am in conversation with Dr. KP Hussain, the maestro of Fathima Healthcare Group. Hello and welcome to the show.
Thank you.
Well, doctor, first of all, I would like to shoot an ace question to you, and that is, well, doctor, tell us all about yourself.
About myself, is last 25 years I am here in this Emirates. After my studies, working 4 years in back home. I thought, every Indian used to think about those days, the Gulf countries. So I'm one among them. I came here with a very positive mind. Those days we were looking into what we can, take back is money.
Money.
That point of time, what I need is the money to give it to my society, not as a money, as a health. That made me to come here. And of course, it is it was a real struggle. But again, the point of that, as I said, it is the purpose is basically it's a social reason. Otherwise, I don't need to come here because in an average family and as a doctor, I can practice very well in that. My aim was that to make one hospital. Any doctor will dream the similar way I did it. But end of the day, here it is when I came here. It's not that what we thought of it.
Expected.
Yeah. So then, there was a real struggle time of, 3 to 4 years. In fact, that is helping me today. Moreover, it is like, I have seen this Emirates is growing like, as today you are seeing it, it is maybe 30% of that, those days. Not like today what we are traveling, the road system and buildings and the infrastructure, it is, if you talk about the overall environment in the Emirates, in my experience, it's really the good experience because I had an opportunity around 40 countries to, I have visited and I'm exposed to, the commercial as well as social and the medical industry, how it works and all. But particularly the Emirates, especially UAE, I think it's one is that I can say that in my experience, it's a very remarkable one. And then if you talk about any comparison, definitely, the attitude of the rulers here always push to all the people who are here, whether it is they have come for a work, whether here they come for a business, all of them are getting equally the opportunity. That's the most important. Person who comes here for a job, he gets a lot of opportunity. Person who comes here to invest here, and they get a lot of opportunity. They're basically the rulers here, their vision, and then always it is associated with the, our community. Especially, I am one among the most privileged person here. When I came with the dream, if you ask me, did you fulfill your dream? Yes, of course, it is, it's basically what I said in earlier. So it's not only the opportunity, the vision and the continuous drive, which we used to see from our leaders. So thereby we put on ourselves in front. So things makes in a more drivable mechanism. That's the thing which has helped me. In fact, I started some clinics. I started working with Iranian hospital initially, and then moved into one of my very simple OP clinic, and then moved to many clinics in this Emirates. And then in 2000, I have switched over to the health industry. There was a reason, and that reason, how it is I am become an insurance person. It's basically, those days, people come from a different part of a world, especially the third world country. When they come here, they just come for the basic labor job. When, as I said, that the growth which is very remarkable, and it is never happened. It's without them. When I looked at this, I used to get a lot of patients who are not getting medical treatment, who are not having the facility here. Those days it is. So I thought I should do something here. The people who comes from different part of the world, especially the low income group, to get something. So that was my partly, making myself in my business movement as well as the
corporate social responsibility.
Then it's really that point of time. It's important to gain the knowledge. It is important to understand the financial situation. It is important to know the facility here. I just started moving into the market in all those kind of aspect. And finally, in 3 years' time, I understand that I can do something for the blue collar people. So then, 2002, we started making an insurance program with insurance companies. I have created a concept after doing a study, and I was, I don't know, I'm not an insurance person at that point of time. I'm just, the idea is how to give them a medical facility. That's it. And then nothing more, nothing less. So then I have seen that what is the facility here, and then those days we have a lot of good doctors, good medical clinics who came from India, another part of the Asian countries, used to cooperate with us, so that we join as a joint hand. Initially it was 14 clinics became this part of this venture
entity. Okay.
And we tested. 1 to 2 years we tested with some of the corporates who gave us, okay, please take care, because that point of time, what was the issue? The basic issue is that people have to go for a treatment, then they'll have to pay a lot of money. A labor or an employer or a rich man in this kind, there is nothing called it's all equal in front of the doctor and in front of the treatment method. Because for me, for anyone else below to me or above to me in financially, the most important thing is easy or affordable is the question. That's the major question. That point of time, I'm sure it is, because as I said, it is. I'm partly monitored here the economical situation, especially the blue collars. Those days it's a salary of 800, 1,000, 2,000, and they are not able to, because people who are those days we have monitored 40 above, always they get two kind of disease like hypertension or diabetes, or you can say that many of them are again 3 disease, which is a heart related disease. We used to receive many patients in our clinics. We have a clinics that point of time different part of the Emirates. So we used to receive those. What we have come across, people who come and visit our physician or cardiologist, moment a patient is having a chest pain and it leads to the cardiac problem, and then to see the cardiologist, that point of it, it's very rare here. We could have, we had one of that department. That those days, I used to see that the patient comes to meet him, because again, it is not a GP or a physician, cardiologist. You have to pay a little higher consultation fee.
Being a specialist doctor.
Specialist doctor. And then, for us to bring here also, it's costly.
Difficult.
So that, when we looked into it's one another way, we always see that, every doctor here, that, human touch is there. That nobody can come and tell me that, doctor is not having. No, the basic idea is when they study, when they prepare to go for the study, there is a human touch is there. That is very clear to any doctor, any level of doctor. But unfortunately, the situation here, when we are coming and bringing the doctor here, it costs us. So thereby the consultation will be a matter. Then those days, the medicine cost is what you are today, it's much, much better here. Now, those days, you to get let's say you have a diabetes, hypertension, some heart disease. You need a minimum 600 dirhams, that point of time, minimum to manage your monthly medicines.
Only for the medicine.
Only for the medicine. And then to see the doctor. and his consultation. And then if you do, some investigation, ECG, talk about echo treadmill, this I'm talking about only one particular, the specialty, super specialty. If that situation, where is his money? What is his income? How he can manage? And I have seen in 2000, 4 to 5 people died because this facility is not there, or they don't have a money and they are not able to reach the facility. Okay, definitely the UAE is always helping. From the beginning I have been noticed, and today they are not only helping in UAE, they are helping the entire world. Even though the population came here, all the expatriates compared to the local, it's much more. So that, there is a limit for any government to do. So in 2000, they started looking into people to come in insurance. I got opportunity to move the undersecretary that time, the Ministry of Health, and I was sharing one among the people who thought in my way, and then it's really helped me to learn, helped me to work on, and we arrived at one concept, which is, we call it a cost-effective management.
Cost-effective management.
Yeah, but that cost-effective management, as I said, it is medicine cost is that time there, and the consultation and the things are there. It is, and the investigation, it's the same, remains same. But some good doctors, especially the owners of those days, had come up. Those days we don't call it the third-party administration insurance. We don't call it a medical insurance. There was only 1 or 2% medical insurance was there, and that too only the corporate used to give managers and GMs that category. The lower category they don't give. Yeah, there was a facility that they can take a medical card from the government, then they can go, and the medical services given by free service to the card holder. End of the day, that is stopped after a period. When they stopped, this is become a big issue. In 2002, we thought it is the price for any medical insurance which cost 3,000 to 4,000. That point of time, how we can make it collecting from many people into the pool, so that we can reduce the price per person. We thought that time 600 may be possible, and we thought it is. We started approaching the corporate. Some of the corporates thought it is, yes, it's a good idea. If we are going to pay 3,000 to 4,000 for our 1,000 employee who works here, then we are talking about 3 million. And what we brought it in the market, we are talking about 600,000.
Makes a lot of difference.
Yeah. Most of the things, if you see that in any insurance, many of them you can hear it from the market. I never used that company is giving me an insurance card, but I never used. He should be thankful to God.
Yeah.
Okay. But end of the day, when we looked into that population, how many of them are not using? When we have come across, it's a 60% of them are not really using it. So what we are talking about, 3,000 per person collected, then the major share is gone to unnecessarily. That economic, is not really practically needed in this market. When we looked into this with the 600 dirhams, and we started, the insurance company started issuing policy in, initially it's a trouble. Any project you talk about, you need that pool in a satisfying level. The platform, you should fix it. We really worked hard for 3 years' time, and after 3 years, we have come 85,000 members. Then it is, to be honestly, I would say that with this small amount of contribution, everyone in this market, many of the corporate, at that point of time, I can understand around 400 corporates, 30 people, 50 people, 100 people, who are working in their institution, they all came into the picture. And then end of the day, 85,000 members, when it came, it's a money. It's a good money, which we looked into. the people who are really sick, people who are really in need of it. If we talk about, in average in this market, what we have come across, in a year, a card holder, average, 3 to 4 times they visit, whether it is with regular reason or it is seasonal reason. You have now the summer is coming up now, so you have a lot of summer related disease where they need to go to the doctors. When there is a winter comes in December, you see a lot of bronchitis and other things and all. It comes in the January, February and all. So when we looked into the insurance point of it, the average visit per person in this population is 3 to 4 times is it.
Yeah.
So when I looked at it, this is what actually, then why are we
charging them?
Not really doing the service to the society, but always we talk about the high price. It was really, really a difficult insurance company to switch over to this, because as they used to think of that 3 to 4,000 is the solution, which I went, and if I tell them 600 is possible, it was them to many of them, they said no, it's not possible. At that point of time, I should salute today when we are successfully running, and it's a role model and it is tested, and now government is taken. It's our practice in this last 10 years, whatever we have done, we shared with the government. And then the data is looked into all the, the possible, the best people in the knowledge gain people looked into, and then they says this is one of the successful project. In fact, it is, if you ask me, all this 8-9 years, what I am doing is extraordinary, and the services come up in the international level. And if you talk about the facilities provided more and more and adopted the upcoming hospitals and clinics all in our part of it and serving these people. So the story is like, once somebody thought it is not possible, we made it as possible with the cost effectively. A very affordable mechanism. Any corporate, do you think that if I have 1,000 people working in my contracting company, do you think I can pay 3 million budget as allocate? It's not possible.
Not possible.
So what is possible we have penetrated in this market with the help of health authorities, with the help of those days the Ministry of Health, the undersecretaries who really gave us a chance to know, learn, and then move friendly, and in association with the insurance company, we made it possible.
As a whole.
So if you ask me about me, this is what I am.
Shall I take a different turn? A winner never quits and a quitter never wins, and you won the battle.
Definitely, yeah, that's exactly.
Well, what does Fathima Healthcare Group do? In fact, we would like to know what is your core business, or what is your core service?
Fathima Healthcare Group is today, we are into GCC, and in UAE we have around 1,500 medical providers in part of our network, which is called FMC Network UAE. It is a registered institution from the insurance authority as well as the health authorities of different emirates. And in our office here, it is in Dubai as well as Abu Dhabi, and we have an office in Qatar, Bahrain, Oman. At this point of time, we are around 400 employees in and out, and majority of them are doctors, medical professionals, pharmacists who drives this, the medical insurance scheme very effectively, and their support definitely I can say that today we are planning end of this year to move on Saudi Arabia, because we have a invitation from sheikhs who asked us the role model what we made it the tested product here. They have invited, and last year we visited there, and then our preparation is going on for the coming October and all. Apart from that, we are now started moving in crossing the GCC country. In African country, Mozambique, we have identified two of the place where we need to be not only as an insurer, as we started here as the medical service and first aid support. So this is the journey. It's never going to be end, because we find this concept is suitable to the entire world, irrespective of what is financially going to be placed. But again, the concept which we created and running last 10 years in UAE, it is really, really, if people put into this kind of concept, what we are talking about today, some of the world, some of the countries, our third world country is not providing facility, can be move on this direction. In fact, it is, I had 2 years before Delhi Chief Minister, Madam had asked me to, present this project, as well as now the Kerala is also asked us to present it. We are working on now.
Fine, fine. Well, lastly, I would just like to ask you as to what is a health insurance? Why health insurance? Which policy should I opt for? How do I make a claim? Or which insurance company do I choose? These are the questions that come across my mind or our mind or people who are ignorant about this. So if you could just let us know or give us a insider on the same, it will be very helpful.
In fact, all this are very good question and a valid questions. Let me put it to you this: why the medical insurance is required? As you know that any person, today, rich or poor or the middle, all of you need a medical service, because our environment is now, it's not as we all enjoyed in our school days or college days. Lot of physical activities, it's not only those days which it was situation. We move around, we, see the things in a very physically, movements are, most of the times involved. You talk about that kind of transport and the situation where we have today, the modernized world, especially if you talk about the Gulf region, many of them are, not really going with, social life. And many of them, when we see that, regular exercise, all that, we can talk each other and we can blame each other, So what makes it is, it's now the medical insurance is everybody required. And why it is required? Because we never know. And what we talked about, the amount what you are going to pay, it's something like, some of us, for a 1 or 2 dinner when we go, what you pay, that is the money what, if you talk about Abu Dhabi Health Authority, Dubai Health Authority, the basic product is, it's 600, 700 dirhams only. So if you talk about affordability, yes, it's affordable for anybody, even a, low income people. Then how it is helping that low income? Talk about you have a gastritis or gastric related ulcer disease. You talk about you have a chronic disease. Can you tell me how much you are going to pay? I will tell you, for a maintenance only for a hypertension, in a year a person required 5,800 dirhams. This is, we talk about
the average.
There is nothing comes in above that on a troubles. It is a maintenance dose, visiting 4 to 5 times doctors. If you talk about this itself, the money for medicine, money for the investigation, money for the consultation, that is what it is. And you talk about cardiac cases, it is required 10,000 to 15,000. You talk about kidney disease if you are having it. We pray nobody should be in that part of it. But again, unfortunately, I've been doing some charity back home. It is, the kidney dialysis center. Thereby, I know that what it costs per person per visit, and this dialysis every alternative day is required,
continuous
or every 3 days required. It depends on the kidney filtration program. So most of the patients in every second day they need. In India alone itself, it is a 3,000 to 4,000 minimum they need to travel and to get this dialysis. So if someone is here, and what will be the situation?
Absolutely.
So there is no question comes now at this point of time, because the environment is not really supporting us. Our surroundings, we are not realizing and moving forward to the physical activity more than compared to what we are doing today.
Yeah.
So in such a situation, there is no question why we need a insurance. So it is, I would call it it is really, really, if you talk about who is giving you a best security and protection, is the insurance.
It's a necessity nowadays.
It is a necessity now, because you talk about even the seasonal issues. You are going to visit 2 or 3 times, and this cost what you are paying is it's much less than that. So thereby, whatever the Abu Dhabi government and the Dubai government now implemented, and the rest of the other governments are following, and because it is not able to just one fine morning we can announce and it's possible to everybody. There is a preparation level,
step by step,
and implementation level, and then to make sure, because see that now in last 5 years in Abu Dhabi, population, the entire population is enjoying a health insurance secured system. So thereby I would say that many of the family, I have met them, they say that, oh, I have insurance card. It's like a protection. Those days what we used to do, any disease comes,
panic.
It's a big panic, and we don't know what to do, how much it is going to cost, and where will be all. And this is now, it is a good thing is that the employer paying this the insurance fee. So this is where it is employer can extend his relationship with the employees. So thereby the protection, how it is the good relationship, and then as I said, it is how we are managing it, the unity of the many physicians moving into this particular sector, helping us to move forward. And achieve this. So it is not as one particular government only can do it, or only physician and the person who is purchasing the insurance
policy.
It's all of us, we are contributing. As I explained you, it is because everybody thinks there is a security required. So I may not be the sick person, the other person is there. With my support, he gets. His support I am getting. So that what we are making it, insurance scheme, compulsory program, one should consider it is a good relationship among us.
Okay.
This is the most important. The second point, it is how it is possible. It's each insurance company, they have a toll free, they can call, like we have a toll free, they can approach us, then we recommend the insurance companies. So the basic idea is, we are associating with among us to think forward to provide medical facility. I think this is the most important things. The 3 important things out of that, health is, as you know well, I don't need to tell you because you have come up with, one channel, 100% health information.
Yes.
I can understand the purpose of bringing this channel to our society. I have been seeing that last few days, in the channel, what are the information is not only you are giving to the public, even you are giving to the, doctors,
Correct.
the medical practitioner. So where definitely if our people, the public, if they spend half an hour, 1 hour, it is definitely they are getting a lot of information.
Okay.
So our, attitude towards, putting each one of us to be a socially responsible people. So then the question comes, it is, equality. I think I would say that, the people, especially the respectable sheikhs here, they made it everything here, not only for the rich. Each one of us who are really enjoying, each and every day when we open our eye until we close it, we are enjoying the entire atmosphere. It is not only for the rich people. So that attitude we should have in the health industry also. I would recommend every corporate should understand, when you are giving this medical insurance, you are making sure their medical security. That is the most important thing in this part of the world. We need to give that kind of security. Thereby what will happen, at least that worry is the big worry which is you put on the side. So I think it is, everybody should respect the government, how they are coming up, and we all will be a part of it, and let us make it a strength that our society is helping each other. From Fathima Healthcare Group, we are ready to help you any point of insurance related queries as well as health related support. We are working here 24 hours, about 7. So you can contact our toll free 800 3426.
Thank you very much for your valuable time and valuable information, and we look forward to associate with you in the future as well.
Thank you.